Today in this video we're going to be covering the cancellation process for any patients who've entered theatres and how we would deal with the documentation of that case. So if a patient's already entered theatres, we would have started some of the perioperative documentation. We would have done this within the power chart application and into the perioperative documentation section of the patient record. So we can see here along the left hand side, we can see that the green ticks denote any of the segments which have been completed already. The asterisks in red denotes any segments which are mandatory and need to be completed. Any segments that don't appear with a green tick or an asterisk are segments which can be completed during the case but aren't mandatory and can be discontinued if we don't need them. So in this instance, all of our documentation we've completed accurately up to the point of patient cancellation. Patient's status deteriorated, so we now need to discontinue any segments which we haven't documented against. And in order to do this, we would select the segment, right click, and go on to discontinue the name of the segment. So we'd repeat this process for any of the segments which we haven't documented on. So discontinue skin assessment, click on skin prep, right click, discontinue skin prep, click on closure and dressing, right click and discontinue, and we would repeat this process for all of the remaining segments which aren't mandatory and we don't need any record against. So obviously the segments which we have documented on have completed, we would leave them as they are because it's an accurate record of where we got to within the case. We would go into the add segment folder or icon up here. We would click on it and we would need to scroll down to find case abandoned. We would select case abandoned and use this arrow which points to the right to push it into the selected segments. Once we hit OK, this will now appear within our set available segments along the left. So we would click on the case abandoned segment and we can see they've got 4 fields within the segment, only one of which is mandatory. The first field is the abandonment reason. So if we click the drop-down option, it will give us a list of appropriate abandonment reasons. We can select from this list, or if the reason isn't available on the list, we can select other. And we can see here it says details must be provided. And we have a free text box here for us to document the abandonment reason if it was other. So we can say who it was abandoned by, so who the senior member who cancelled the case was. And we can add any abandonment comments in here if we need to. We can also add any additional comments into this free text box if appropriate. And once we've completed the appropriate fields, we can navigate to the procedures segment. This will now mark case abandoned as tick. Within the procedures segment, we can see within the box the procedure that was originally requested and planned to happen is already all the information's there from the original order. So we would select the procedure from the box and go down and hit this remove button down the bottom. It'll ask us, are we sure we want to delete the entry? And we're going to say yes. It's just telling us that we've recorded some information on another segment that is linked to that procedure, and are we sure that we want to remove it? And then we're going to say yes. And this now empties the box of any information as well as the fields. Within this procedure field, we're going to search for abandoned procedure. Once we start typing, it will give us anything in the surgical catalogue that matches that procedure. We can see here we've got abandoned procedure bracket S. This denotes it's a surgical procedure. We also have the same procedure with the prefix of EM before. So this one is for an emergency procedure that's been cancelled, and this is for an elective procedure that's been cancelled. So we had an elective procedure requested, so we're going to select the elective abandoned procedure option. We're then going to complete all of the remaining fields which are mandatory. So in laterality, we're going to say it's not applicable. We're going to say it's a primary procedure. We're going to say that anaesthesia type is to be determined. The consultant surgeon's whoever's going to have cancelled it. If I can find a surgeon. And we're going to say that they were present. The operating surgeon will be whoever you've documented in your case staff. So I've only documented one staff member, so I'm going to select them. And the procedure speciality will be, again, the speciality of the procedure that was cancelled. So we had ophthalmology for this case. Procedure wound cast will be none. And we can see there's 2 pages to this segment, so we're going to select next. And we're going to document the start and stop. So these can match the times that it was cancelled. And then finally, we're just going to hit this add button, and it's going to pop the procedure into the box, replacing the other procedure. It's just asking us, do we want to add any inventory items associated with the new procedure? We're going to say no. And then we are going to go back into patient position, just click on it and it will change it back to there. And we're going to go into case times, and we will need to still document the surgery start and completed, despite the fact that surgery didn't start and wasn't completed. We would just match this with the abandoned time. So the time that we have said that it was abandoned in the procedures was 4:50. So we're going to say 4:50 here, 4:50 here, and 4:50 here. We can say the patient left theatres at this time, and the outcome was that the procedure was abandoned. If we click off this segment, we can now see on the left hand side that all of the segments either have a green tick next to them or a grey splodge. Now that all of these match that criteria, we can finalise the record. So we would navigate to this green flag up the top and we would click on it. It's telling us that we need to sign or countersign some of the segments. So this relates to the who sign in, who we've put a countersign against. So we need to just tick these 3 top boxes and it will select all the rest of the options. We're going to hit the sign button. Once you've signed the record, you would hit close, and then you would click again on the green flag to finalise. There will be a pop-up box that says that you no longer have any deficits and the record would close. If you go into the documentation segment and refresh it, because the case has been finalised, the intraoperative record would appear here for you to look at.